Have you ever felt like your period was trying to specifically ruin your day? The heavy bleeding, painful cramps, the constant bloating that makes you wonder if your body is sending you a message. For millions of women, that message could be simply uterine fibroids. Fibroids are one of the most common conditions affecting women today, yet many people have never heard of them until they are being diagnosed. And because they are often dismissed as just bad periods, many women suffer in silence for years. So, what exactly are fibroids and why should every woman know about them? That's why I'm here today. So, welcome to my channel. My name is Mira, and if this is your first time of seeing me, please don't make it the last by subscribing to my channel so you keep getting value-filled content for your time. We don't beat around the bush here. We just go straight to the point, hit the nails on the head, and move on. So let's begin. So, uterine fibroids, also called leiomyomas or simply fibroids, are non-cancerous growths that develop in or around the uterus. They are made up of muscle and fibrous tissue, which is where they get their name, fibroids. Think of them as knots or lumps that grow from the muscular wall of the womb. They can be as tiny as a seed or as large as a watermelon. And that's why in some women it can go unnoticed for a very long time, and in others it's very, very prominent. Some women just have one fibroid while others have multiples. Okay. Now, the good news is that fibroids are almost benign, meaning they are not cancerous. In fact, fewer than 1 in 1,000 fibroids turn out to be cancer, so don't be scared. The main types are intramural, which grows within the walls of the uterus. There is the submucosal, which projects into the uterine cavity, being inside the womb, and the subserosal fibroids, which grows on the outer surface of the uterus. Now, the exact cause is not fully understood medically, but hormones, especially estrogen and progesterone, plays a major role in its occurrence. These hormones stimulate the lining and the muscles of the uterus during the reproductive years, and unfortunately, they can also encourage fibroids to grow. That is why fibroids are mostly common during the childbearing years of a woman. They may enlarge during the reproductive years and often shrink after menopause. And that's why so many women go about their lives thinking, oh, they've never had fibroids, they've never experienced it. Genetics matter too, and that's if your mother or your sister had fibroids, your chances of developing them are higher. And depending on their size and location, they may cause no symptom at all, or they may cause significant changes in a woman's body. While many women can develop fibroids, some factors increases the risk of occurrence. First, age. Between the ages of 30 and 50, it's very common. Having a family history of fibroids, like I said earlier, being of African descent, we are more susceptible to the occurrence. Starting menstruation at a very early age, being overweight or obese, eating a diet high in red meat and low in fruits and vegetables, and having low vitamin D levels. Melanated women like me in particular are more likely to develop fibroids, often at younger ages, and may experience larger or more numerous fibroids. So sisters, take note. Also note that even without a family history, fibroids can still occur. So don't just assume you're off the list. Try getting checked and also follow up with your supplements like vitamin D3. Like I said earlier, not all fibroids causes symptoms. In fact, many women do not know they have it until they go for their routine checkups. But when symptoms do occur, they can be very difficult to ignore, and they include heavy menstrual bleeding, periods that last longer than a week, severe menstrual cramps, pelvic pain or pressure, frequent urination, difficulty emptying bladder, constipation, lower back pain, pain during sex, abdominal swelling or bloating, and some women even describe looking several months pregnant because of the large fibroids. Now, can fibroids affect fertility? Yes, fibroids can interfere with fertility implantation, block the fallopian tubes, or distort the uterine cavity. This can make it harder to conceive or carry a pregnancy to term. Fibroids may also increase the risk of miscarriage, preterm labor, breech presentation, or a need for a cesarean delivery. However, many women with fibroids still conceive naturally and have healthy pregnancies. Okay? For diagnosis, fibroids are often discovered during a pelvic examination. To confirm this diagnosis, your doctor may recommend a pelvic ultrasound scan, which is the most common imaging test, or an MRI, especially for large or multiple fibroids. Another imaging test that is used is a hysterectomy, where a small camera is inserted into the uterus for visual purposes. These tests help to determine the size, the number, and the exact location of the fibroids. Now, for treatment, it depends on several factors, which includes the individual symptom, the age, the size of the fibroids, and whether you want to have children in the nearest future. So, if the fibroids are small and not causing any symptoms, monitoring may be all that is required. But where symptoms are present, medications are given to help manage symptoms such as heavy bleeding and pain. Hormonal therapies may also temporarily shrink fibroids. Minimally invasive procedures to resolve this condition includes: first, uterine artery embolization to block blood flow to the fibroids, causing them to shrink and die off. Another is the MRI guided focused ultrasound. It uses sound waves to destroy fibroid tissues. But in severe cases, surgeries like myomectomy removes fibroids while preserving the uterus. And there is also the hysterectomy, where the uterus is removed, and this is the only permanent cure. And that's why I said treatment depends on location, size, and your future reproductive plans. You should seek medical attention immediately if you experience any of the following. First, heavy bleeding that soaks through pads or tampons every hour. Secondly, periods that last longer than 7 days. Third, severe pelvic pain during urinating. The next is symptoms of anemia such as fatigue, dizziness, or shortness of breath. Never assume heavy periods are just something you have to live with, because they are not, okay? Fibroids are common, but they are not something to ignore. They can affect your quality of life, your fertility, and your overall health. The good news is that effective treatments are available, and many women go on to live healthy, symptom-free lives. And that's why I advocate for checkups, early checkups, even when you feel you are fine. Going for a full body checkup would guarantee you healthily watch your health. If there are any issues, they are diagnosed and treated early. So, if your period has changed, or you feel persistent pelvic pressure, or if something doesn't just feel right, listen to your body, sisters, and get it checked as soon as possible. Your symptoms are valid, and getting answers that could make all the difference is key. Thanks for watching this video. Like and subscribe to my channel, and I'll see you in the next one. And until then, love yourselves.